In the US, about 30 million people have diabetes. Wrong there to 90 to 95% of cases of diabetes type 2. Many studies have proven people with type 2 diabetes may increase the risk of deafness, hearing loss. Therefore, following treatment guidelines and controlling blood sugar are important to prevent hearing loss. Research on the link between diabetes and deafness. A 2008 study analyzed data from hearing tests of adults between the ages of 20 and 69. Most of the study participants had type 2 diabetes. The results of the study suggest that diabetes may contribute to hearing loss through damage to nerves and blood vessels. Similar studies have also shown a link between deafness and nerve damage. Deafness. 2013, a research team analyzed documents from 1974 to 2011 about diabetes and hearing loss. They concluded that people with diabetes were more than twice as likely to have hearing loss than those without the disease. Causes of deafness in people with type 2 diabetes. The cause of hearing loss in people with type 2 diabetes is still unclear. High blood sugar can damage blood vessels throughout the body, including those in the ears. If you have had diabetes for a long time and it is not well controlled, the capillary networks in your ears can be affected. Women with diabetes have a higher risk of hearing loss than those without, even when the disease is well controlled. Women with diabetes are at increased risk of deafness. Complications of diabetes can also damage the auditory nerve. This can easily make you deaf. What are the risk factors for hearing loss? To date, risk factors for hearing loss in people with type 2 diabetes are unclear, according to Healthline. You will be more susceptible to hearing loss if you cannot control your blood sugar. That's why it's so important to follow your diabetes treatment plan. If you have both diabetes and deafness, the two conditions do not necessarily have to be related. There are many other reasons for your hearing loss, including exposed to noise loud for a long time, old, family history of hearing loss, earwax buildup or foreign body in the ear, virus or fever. There is a structural problem in the ear. Eardrum. Side effects of certain medications, such as chemotherapy drugs. Some medications can cause hearing loss. Diagnosing deafness. Deafness can progress slowly and sometimes you may not notice it. Children and adults alike can experience hearing loss at any time. If you suspect you have a hearing loss, ask yourself the following questions. Has anyone complained that you can't hear them? How often do you ask people to repeat words? Do you think that people around you mumble a lot? Are you having problems participating in chats with more than 2 people? Has anyone complained that you listen to the TV or radio too loud? Do you have trouble understanding conversations in crowded rooms? If you answered yes to more than one question, you should see your doctor and have your hearing tested. Hearing test. First, your doctor will examine your ear for blockage, discharge, or infection. You may then be asked to take a tuning fork test to assess for hearing loss. This test helps determine if the problem is with the nerves in the middle or inner ear. Depending on the results, you may be referred to an specialist or audiologist. Another diagnostic method is audiometry. In this test, you will wear a set of headphones. Sound in different ranges and levels will be transmitted to your ears simultaneously. You will be asked to point out a certain tone when you hear it. Treatment of deafness caused by diabetes. The most common treatment for diabetic hearing loss is the use of hearing aids. Your doctor can advise you on the type of machine that best suits your needs and lifestyle. Other treatments will depend on the cause of the deafness, including use of drugs for acute infections, remove earwax or other obstructions, cochlear implants, depending on the condition of the nerves in your ear tie. Surgery may be needed if you are deaf due to birth defects, head injury, chronic middle ear discharge, chronic ear infections, tumor. If you are prescribed a new medication, be sure to ask about its side effects. In addition, You should also share your information, conditions, and concerns about diabetes and hearing loss. This makes it easier for doctors to visualize your overall health. Treatment of deafness. In some cases, you only have temporary hearing loss. Early treatment is an important factor affecting the process of hearing rehabilitation. For certain forms of deafness, people with diabetes or high blood pressure have lower rates of recovery. Ways to prevent diabetic deafness. If you have diabetes, you should have your hearing tested every year. In addition, you also need to be aware of measures to prevent hearing loss and other complications from diabetes, including: follow your diabetes treatment plan. Closely monitor blood sugar. Manage high blood pressure. Weight management. Exercise regularly and in moderation.